I'm Carol Celine, talking with nephrologist Dr. Yasmin Brahmbatt. Tell us a little bit about your specialty, nephrology.
I see patients with abnormal kidney function, kidney stones, blood pressure problems, potassium problems, etc. I see patients who may need a kidney transplant. I see patients who have had a kidney transplant or may need dialysis.
And what is your particular job? I mean, what do you have to figure out besides treating them?
So there are lots of different causes of kidney disease, and if there is a treatable cause, we do try and treat that to prevent the kidney function from worsening. But there are many times when kidney failure is not really preventable, and I try and prepare patients for what's to come, either dialysis or transplantation.
Dialysis, as you mentioned, is one of the most common treatments for kidney disease. And I know that it can be quite a burden because I know people who've had to go through it. Have there been any advancements in the standard dialysis?
There have been advancements, and in Europe now there are studies ongoing about on patients who are actually on home dialysis, where they wear the dialysis machine around their waist and they walk around undergoing dialysis instead of having to sit at a machine.
And is there anything in the pipeline that's coming along that will even make it easier?
Yes, there is another dialysis machine that's being developed right now, and it's about 5 to 10 years away from being used routinely, and it's called a nanodialysis machine, which is the size of a pacemaker, and this nanodialysis machine will sit underneath the skin in the belly and provide 24 hours a day of dialysis, 7 days a week.
And if that is successful, would it mean there wouldn't be a need for kidney transplants?
Yes, that would eliminate the need.
Oh boy, that would change kidney disease completely,
Yes,
wouldn't
it
would. What advice do you give your patients?
I tell them to live in the moment, make the most of every single day, and I think that's how we should all live, ideally.
That's pretty good advice for anybody, whether they have kidney problems or not. Is there a way to prevent kidney disease?
The most important way to prevent kidney disease is to prevent the onset of diabetes and high blood pressure. Both diabetes and high blood pressure are the commonest reasons why kidneys fail.
And should people use those little machines at the drugstores to check their blood pressure to know if they have a problem, if they're not seeing a doctor regularly?
Absolutely. They're very good screening measures, and they measure the blood pressure accurately.
Well, I'm relieved to hear that because I do it all the time. Thanks for coming in.
Thank you.